I'm Mary Jo Heinz. I'm an independent Medicare insurance agent. Today, I'm going to talk about what you should do when you turn 65 in regards to Medicare. For the past 10 years, this is all I've done is help people with Medicare exclusively. I don't do any other kind of insurance. Prior to that, I was a medical practice manager. In that role, I was helping patients understand their insurance. So I've been helping people with healthcare and insurance for a long time. As I was crafting this video, I was thinking, well, we're just going to talk about enrolling in Part A, but I'm also adding a few thoughts on why it's important to work with an independent Medicare insurance agent. Let me share my screen so we can get to it here, and you'll have a visual as well as audio. What to do as you turn 65. Number one, find an independent Medicare insurance agent to help you assess whether you should even go on to Medicare. Your circumstance is different than your neighbor's, it's different than your cousin, and a Medicare agent can help you cut through all of the stuff, all of the mailings that you're getting, and help you understand what your options are and whether you should even be going on to Medicare. I recommend that people enroll in Part A when they turn 65, even if they're still working and they're on their employer plan. Here are the 3 reasons why I recommend that. First, you get additional coverage if you're hospitalized. Your employer plan would pay first, but then Part A may give you additional coverage. This is particularly important if you have a high deductible health plan. Secondly, there's no premium for Part A, so you're not at risk or out any dollars by getting something that you have to pay for. The third reason is the most important reason. You get your Medicare number when you enroll in Part A. Okay? If you have a circumstance, perhaps a change in health, a change of employment, where now you have to move quickly onto the other elements of Medicare, if you already have your Medicare number, you are so far ahead of the game. So having that Medicare number is really helpful for the future. So when should you enroll in Part A? I suggest that people do this right at the beginning of their initial enrollment period. Your initial enrollment period is 3 months prior to your birthday month. So I'm going to use myself as an example. I'm a March baby, so my initial enrollment period began December 1st. It always is the first of the month in Medicare, even though my birthday is later in March. So I enrolled right away at the beginning of December, so that if there were any hiccups, I had all of that time to, iron anything out. Now my enrollment went very smoothly. I enrolled online on the 1st, and then I started monitoring the Social Security website to get my benefits verification letter. And by the 6th of December, I had my Medicare number. Later that month, I got my card. So it was a breeze for me. And I have friends sometimes say, what's the big deal about enrolling in Medicare? Well, I was easy. Some folks really have problems working with Social Security to get their Medicare enrollment done. I'm just going to give you a few little anecdotes here. In the past 6 months, I've worked with a couple of women who were stay-at-home wives and moms. And when they went to enroll in Medicare, it said, oh, you haven't worked enough quarters. Well, you're filing a joint tax return with your spouse, and you qualify under your spouse's working quarters, 40 quarters. But Social Security didn't have the Social Security number of the spouses linked together. It took months to get that resolved and for them to issue these women Medicare numbers. Okay, so that's one instance. If they had waited until a week before their deadline or their effective date, they really would have been messed up. Okay. Second circumstance is if somebody's born outside of the United States and you have to prove citizenship. This can also take months to get resolved. All of these things have become more cumbersome since we can't go into a Social Security office and resolve things since they've been closed since March 17th of 2020. The last circumstance was so odd. it was a man who was born in the United States. I thought it would be bada bing, bada boom to get his Medicare number. But back in the 1970s, someone at Social Security typed in his birthday wrong. They typed in August 27th instead of September 27th. So when he tried to enroll in Medicare saying, I'm eligible now that I'm 65, all these red flags came up. It took months to resolve this. The first copy of his birth certificate, they wouldn't accept. He had to get another copy. All of this due to a clerical error 50 years ago. Things can happen. So do it right at the beginning of your initial enrollment period. And then if it goes smoothly, you're all good. If there's a little problem, then you've got time to resolve it. This recommendation for enrolling in Part A when you turn 65 has one significant exception. That is, if you are contributing to a health savings account. Now, this isn't an FSA, use it or lose it. This is a different sort of account that's tied to a high deductible health plan. You can put quite a bit of money into it. It rolls from year to year. You can guide it as an investment. It is a significant portion of some people's retirement planning. If you're contributing to a health savings account, you cannot be enrolled in any part of Medicare. Why? I have no idea why. It's the government. What can I say? But if you're contributing to an HSA and it's a major portion of your retirement plan, you cannot enroll in Part A when you turn 65, or you shouldn't. It's going to mess things up. So that's why I recommend enrolling in Part A when you turn 65. Additional coverage, $0 premium, and getting that all-important Medicare number. Now let's go on a little bit more to talk about what constitutes an insurance agent who specializes in Medicare. It's not just an afterthought, and this is pretty important. Any insurance agent with a health insurance license can sell Medicare supplements. That is not the person you want to work with. If they say, oh yeah, supplements are the way to go, and oh, you can do the prescription drug plan yourself online, you should have red flags going up saying, this is just an afterthought for this person. They don't know the whole gamut of what Medicare is, okay? You want someone who's independent. They need to be contracted and writing business with more than just one or two companies. I know some agents who are independent, and yet all they write is one insurance company's Medicare Advantage plan. That's all they do. That's not independent or objective. You want objective advice. Someone who can talk about your options and tell you what's right for your health, your finances, and your lifestyle. Okay? They need to know the whole deal. You want to ask them, do they have a mix of supplement and Medicare Advantage clients? You don't want someone who goes, oh, that's no good, I only sell this. That's not an independent, objective viewpoint. You want to work with someone who can help you with all elements of Medicare. They can help you assess whether you should stay on your employer plan or go to Medicare, kind of that pre-enrollment stuff. You don't want someone who says to you, oh, just go get signed up, and once you're signed up, I'll help you get enrolled. That's bad news. Okay? They should be able to give you assistance and tips on enrolling in A and B. They don't do that for you, but they can help you, prevent you from any pitfalls that there might be. And then they need to have the training and the certifications to sell Medicare Advantage and prescription drug plans. As I said, any health insurance licensed agent can sell a supplement. But to sell Medicare Advantage and prescription drug plans, you have to go through additional trainings. So you want to look for someone who can do everything. Okay? So those are my tips for you in terms of turning age 65, where you're probably getting a lot of mail, whether it be email or physical mail, and that's driven by insurance companies. I really strongly suggest that you don't go directly to the insurance company, that you work with an independent agent, because the independent agent can say, well, here's why XYZ insurance company is doing this. And here's why this might be a better plan for you based on your physicians or your lifestyle. Once you go directly to an insurance company, they don't allow you to change to an independent agent. Okay? If you call the insurance company, all you're going to hear is their spiel. You're not going to get an overview of what's happening in the marketplace. Thanks for your time. Check out my website, which is medicareinsurancehelp.com.